Welcome back, everyone. Monday, 10 o'clock. Oh, I just get settled. Oh, we've got a few in already. Good morning, good morning. Finally, the last one of the foot and ankle. I think this is episode 7 for this time round. Last time we ran these, we did them in 4 sessions. And so this year I've added a few bits on. I know some of you that have seen some of the older videos have noticed some of the changes. So yeah, every time it will be different, and because I'll just have more and more time to add things, add bits to the presentations that we're doing. So yeah, so hopefully you've got something out of it, even if you've seen this a couple of times. Right, so we're going to finish off the foot and ankle with just a bit of an overview of everything, and then finish off with the blood supply. Good morning, Becky. Good morning, good morning. And I think that might be Penny. Good morning, Penny, if that is you. Good morning. And yeah, we've got a few people that we met last week at the Therapy Expo. So I know I mentioned it a couple of times over the last few weeks, and it was good to see some people face to face. In fact, there's one of them. Hi, Julie. Good morning. Yeah, so there was a few guys from the movement therapy diploma that were there, which was good. And then we met some guys from the STA as well, and some people that I haven't seen for ages. So yeah, it was really, really good to see everyone. Good morning, Al. So if you don't know Al, if you've not watched this before, Al works for Movement Therapy Education up in Liverpool, in Southport. So he's got a clinic up there, and he's also one of the reps for the Sports Therapy Association as well. Doing some good work up in that corner of the country. So what I thought I'd first do is just go back to the kind of basics really, and just do a quick scan of the foot, and then get kind of orientate ourselves, and then go into the blood supply. If there's anything from the previous weeks that you're not sure of and you want to ask any questions, then just pop them in the group, and I'll answer those as well. So here we have foot. It seems ages ago that we did the bones of the foot. So you have similar to the hand. We've got 2 phalanges in the big toe, and then 3 in each of the other toes. So we've got in the big toe, we've got a distal phalanx or phalange, and then a proximal one. So distal means furthest away, and then proximal means closest to you. And then the other ones have one that's in between as well. So we've got like an intermediate or middle phalange. Then you have your metatarsals, which are the next group of bones. And one particular that keeps on cropping up with things is the 5th met, and that's because it's got that bony lump on just there. That can be the site of a couple of injuries, avulsion fractures, that kind of thing. So obviously 5 metatarsals for each of your toes. And then working down, so this is what we used to do in terms of learning palpation. So if you're a therapist rather than a fitness professional, then this may be useful. So you've got your medial malleolus, which is your inside ankle bone. Then you drop down off of that, and there's a bit of a dip, and then that's your talus bone, and you can usually feel that as long as there's no swelling or anything. And then you have your navicular, which is this long oblong shaped bone here, and you can usually feel medial malleolus. You can feel, then there's a bit of a dip where you can't really feel very much. You might be able to make out the head of the talus, and then the navicular, and then you're onto the cuneiform rows, which is that one there. Okay, so if I just pop it that way, so that one just there. Okay, so you've got your medial, middle, and then lateral cuneiform, and then the one right on the outside, which is next to your 5th met, that's your cuboid. So on the lateral aspect, so the outside of your ankle, you go lateral malleolus, and then drop down, and then the easiest thing to then palpate is that 5th met, because that sticks out a little bit. And then if you come backwards on that 5th met, then you're onto the cuboid. Okay, so that's a good way to kind of orientate yourself with all of the bones of the foot. Then we had all the different compartments which had all the different muscles in. So we had an anterior compartment, And if you think about where the compartments are, it kind of makes sense as to what they do. So the anterior compartment runs down the front into here. So we'll do that. Okay, so all of those anterior compartments just there will extend, well, it will dorsiflex the ankle and also extend the toes. Okay, so that kind of makes sense of where it is. Then we had a lateral compartment which comes down the side here, and that will turn the foot outwards. Okay, again, which makes sense. So we've got all of these muscles coming down the outside will, when they shorten, do that to the foot. Then we have a deep posterior compartment which comes around and then medially underneath the foot here, and they help to turn the foot that way. Okay, so this deep posterior is a bit more behind the tibia, so it's a bit more medial anyway. And then your superficial posterior, which then attach onto the calcaneus, so they do that motion. So they do plantar flexion, where they drop the toes down. So again, hopefully knowing where the compartments are, even if you can't remember the names of the muscles, you can get a good idea about what bit might be a problem. Okay, so if they're struggling doing that, then it's probably something to do with the muscles at the front. Either there's an injury to the muscles or the tendon of those muscles, or they have a nerve issue. So the nerve that supplies that area, there's something wrong there, either locally or at the lumbar spine, which is where it comes from initially. And this all helps your skills in kind of working out what's going on with this person. So if you remember back to the nerves last week, we've got some nerves that supply several areas, and some that are very specific to certain groups, so those compartments of that leg. So if a whole compartment has been knocked out, then there may be something wrong with the main supply coming into that area. If it's just individual ones, then it might be something on the way or something locally. Okay, so it gives us a bit of an idea to work out what's happening. And then, as always, if you haven't got a clue what you're searching for, what you're looking for, then refer them to someone else who knows how to do those tests. And your job is done by going, that's not right. And that's okay to do that. You don't need to have an answer. Yeah, it's sometimes best if things aren't looking right and you're not really sure what's going on, then pass them over to someone else. Good morning, Stevie's in. Hey Stevie, good morning. You're going to be sick to death of me, mate, because we're going to be chatting tomorrow as well on the STA chat. And morning, Facebook user. I'm not sure who you are, but good morning. Right then, let's get going on this. Just pop this one up. Okay, so there is. We talked about the nerves last week, and we talked about the when you lose sensation in the foot, that it may be a nerve problem, but those kind of symptoms as well can also be coming from the arterial supply. So there may be a blood supply issue towards that particular region. Morning, Dan. Good to see you on this morning as well. Good morning. And if we think about that, we were looking at the sensory supply of certain areas from certain nerves, and some are very, very specific to particular regions. So like the inside of the arch of the foot, the outside of the arch of the foot, in between the toes, they all had specific nerves that innovated that particular area, provided sensory information for that area. So it's quite specific. Now, when there's a blood supply loss, depending on where it is, it will be it can be a bit broader. So it can be a bit more of a whole foot area, or the whole foot, the whole undersurface or the whole top surface. So and that's a good way to work out, is it something to do with the nerve, or is it something to do with the blood supply? And everybody will have had that thing where you've been in bed, you've laid on your arm, and your arm's gone dead, and you're thinking, oh my God, what's going on? And then you shake your arm for a bit, and then the blood comes back, and then it's okay again. So usually blood supply issues recover quite quickly, because as soon as you get blood back to that region, then it restores the feeling. Those sensations go away basically. Whereas with a nerve issue, usually they last for quite a long time after the nerve has been compressed. So or may not change depending on which position you get into. So that can give you a bit of a clue as well. Those people who are therapists out there, about what's going on. So these are some of the palpable arteries. Some areas are palpable, some areas aren't. And I'm going to start by the knee. Okay, we haven't covered the knee yet. We're going to start that next week. But there's a big blood vessel behind the knee which you can palpate. You can feel that one, and then you can, if that's okay, and you can feel the beat and it's really good, then you can then check the next one down. And if there's a problem with that one, then we know that there's an issue between that part of the blood supply. Because remember, it's just basically a bit of plumbing. So the tube coming down, there's a blockage in between. You won't be able to feel the one down here, but you will be able to feel it up here. Okay, so again, we can kind of work out if where the issues are. The only problem is humans are notoriously bad at palpating arteries, and we can feel things. We kind of make it up in our own head. So we'll feel something and we think, oh yeah, I can feel a pulse, but you might not be able to feel it at all. So it's sometimes it's difficult to feel these arteries, and that's why in first aid we took away feeling the artery in the wrist, because some people thought that people had a blood supply and that they could feel the beat of the heart, but actually they couldn't. They could just feel what they thought was the beat of the heart, and then didn't do any CPR, so the person died. So that's why they've taken it out now, because it's very, very difficult to reliably test that area. So there are a couple of arteries that we can usually feel, and this is the first one. So this is behind the back of the knee, and we'll have a look at this on the videos in a second. So this is the popliteal artery. Just grab my arrow. Pop that there. So there's your popliteal artery, and then we've got these little arteries that come off the side around the knee, and they supply the knee and the kneecap, and we'll have a look at those when we get to that section. So that muscle there and that muscle there, those are your hamstrings. Again, we'll look at those when we get to the knee. And then these are your gastrocnemius muscles, so your calf muscles. So as the gastroc splits and then attaches onto the femur, your blood supply will come in between those, and we'll have a look at that in a sec. So I'm just going to follow the course of this artery down a second. So this is how it splits, and it's very similar to the nerve supply. So there's your popliteal artery just coming down there, and then we've got one little branch coming off immediately, and that's called your anterior tibial artery. So anterior means it's going to go to the front, and the only way it can get to the front from the back is through your tibia and fibula. But the only problem is, as we know, looking at the connective tissue, there's an interosseous membrane in between those bones. Okay, so providing a kind of block from the front to the back. But right at the top, there's a gap, and that little gap is where this artery will go through. And remember, the nerves go through these gaps as well. So it's quite a good design that we've got from the back through to the front. We've got this little gap in the interosseous membrane. So all of your blood supply to the whole lower leg comes from that. Okay, so there's no blood vessels on the front. They all come from this. There's no arteries on the front of the leg. They all come from this artery on the back. Okay, and we'll have a look at the course of it when we look at the hip and the knee. So the first split, anterior tibial. So it's going to be towards the front and along the tibia. So that makes sense. Then this one here is the perineal. Okay, we've looked at that before. So we've heard of your perineal muscles, the perineal or fibular nerves, and now we've got a perineal artery as well. Okay, so that has to be on the outside where your fibula is, because that's where everything else to do the perineals is. Yeah, so hopefully now you can see learning the other stuff will really help you with this. Then we got posterior tibial, and that comes all the way down and then goes down to supply the foot, and we're going to have a look at that in a sec. So in the foot, the anterior tibial, so that one just there as it goes through, will join up eventually with this posterior tibial, and then they form a complete circuit all the way around the foot and supply everything. Okay, so it's really, really clever design. Let's just go on to the next bit. Okay, so this one, there's your medial malleolus. So we've had a look at this a few times. This is your Tom, Dick, and a very naughty Harry. It's flexor hallucis, tibialis posterior, flexor digitorum. So that's your Tom, Dick, and Harry. And then the very naughty is the vein and the nerve, and then A is your artery. So Tom, Dick, and the very naughty Harry, the AVN, artery, vein, nerve. Okay, and they all go down the inside of your ankle. And we had a look at the nerve last week. We're going to have a look at the arteries this week. Okay, and this area here on the inside of your ankle, there's not very much tissue there. So this is a really good place to be able to palpate the artery. So you can put two fingers just behind the medial malleolus and have a feel in there, and usually you can feel the posterior tibial pulse. Okay, so that's a good place to get a pulse. So if anybody's done any kind of pitch side first aid where you're worried about somebody who's lost blood supply to their foot, that's one of the places where you can check it. The other place you can check it is here. So this is coming from your anterior tibial artery, so the front. This is the one that goes through the interosseous membrane and runs down the front. This supplies the top of your foot, and there is an artery that is really superficial called your dorsalis pedis. Okay, and this dorsalis pedis artery is another one that you can feel. So you pop your fingers just on the top of the dorsum of the foot, top of the foot, and you should be able to feel that artery there as well. So again, this is one where if they've had a fracture dislocation of the ankle, this is one that you would check to make sure they've got blood supply to the foot. Okay, so again, those of you that have done pitch side stuff before, you might have heard of this. If you haven't, then you will need to know how to palpate this one. So let's just go on to the next one. And then the last bit for the arteries, this is where everything joins up. And I'll show you the videos of this so it all kind of makes sense in a sec. So we've got the arteries on the dorsum, so the top part of the foot, and the plantar, the bottom part of the foot, all meet up to join together. So if we have a look here, there's your anterior tibial. So that is running on the front of the foot, so it's a bit faded, so indicating that it's on the front. And then it runs down here, and then it goes in between your big toe and your second toe, and it joins up with this artery here, which comes from your posterior tibial artery. So we've got a blood supply from the front, and then a blood supply from underneath, and then they meet each other around about where your big toe is. Okay, so the dorsalis pedis will dive down in between your first and second toe, and then it will meet up with the plantar arteries underneath to form a loop. Okay, so we've got this whole circuit going on. So the most important ones here is your posterior tibial, your anterior tibial, and your dorsalis pedis. Okay, so those are the ones that you will usually have to examine if you're doing that kind of thing. Okay, so that's those are the most important ones. And then the last bit is the veins. Okay, so and there's many different variations of the veins, so you can't really find an image where it goes, these are the veins. Okay, because there are so many different variations. Everybody's different. We've got general vein maps. Okay, and this is one of those. So you might remember the saphenous nerve from last time. So the saphenous nerve was a cutaneous nerve, so it just supplied the skin. This is now the saphenous vein. Okay, so similar kind of region. And we've got, so remember, veins drain blood away, whereas arteries bring blood to the area. Let me just get rid of that. So we've got We haven't covered these yet, okay, but these are your femoral veins, okay, and we'll cover that when we get to the hip. And then there's a branch of the femoral vein that comes down here and all the way down that medial aspect of the foot, and that is called your great saphenous vein, okay, and they'll often use this vein for grafts, okay, so if someone needs a replacement vein somewhere, they'll usually use the saphenous vein. And then we've got another saphenous vein, this time the short, and this comes from the back of the knee. Okay, so as well as an artery at the back of the knee, the popliteal artery, you've also got the popliteal vein and a branch of that. So this is the lateral aspect of the foot. So that area there will drain into that artery, into the vein, and then take the blood back to the popliteal vein, and then back up to the inferior vena cava. And again, we'll talk about that when we get to it. We haven't got there yet. Okay. So yeah, so there aren't really very good many cadaveric images of the veins because they're quite superficial, and it's just like a whole network. But there are some really good ones for the arteries. So I'm going to show you those. Let's just switch on to these. So that was a bit of an overview of everything, and yeah, apologies if it was a bit heavy, but hopefully we can dig down into like piecing those things together. So let's just take that back there. Just pop that on. Okay, so we've got, so obviously labelled up. So this is your fibula. Do you want to start on that one? Yeah. Okay, so this is your fibula down the side here, and you can see that we've got these blood vessels here wrapping around the fibula to supply the bone itself and all of the muscles around it with oxygenated blood. This is the back of your knee, just up here, and that one there, that's your popliteal artery. So that's the one that we were talking about right at the beginning, and you can feel that one at the back of the knee. It's hard to feel your own because you need the knee to be completely relaxed. But it's fairly simple to feel someone else's. You get them to bend the knee and then put your fingers into the crease. But that's your the only blood supply, arterial supply for the whole of the leg. Okay, all comes from here. So that is just a single artery, and then it all then splits. All right, and we'll follow those splits. That's your popliteus muscle, and we'll talk about that when we get to the knee. I'll show you that one in a second. So that's a bit of an orientation. Let's just go through this a sec. So there's your anterior tibial artery. If I just pop that there. So remember, the first branch off, and it goes through the interosseous membrane, is your anterior tibial artery. Okay, so there's your popliteal, so that's popliteal, and then that is anterior tibial. So that's going towards the front. Yeah, so at the moment we're looking at the back of the knee. Okay, just pop that there. And then if we follow that through, here we go. So now it's popping out the front. Okay, just hold that there. So there's a little gap in the interosseous membrane up here, and then it runs anterior to the interosseous membrane. So it's sitting on the front of it, and it will run all the way down between your fibula and tibia. Okay, so all the way down, and it will supply all of those muscles in that anterior compartment. So all there, all the way down. Yeah, so main blood supply for the anterior compartment there. And now we're getting towards the ankle. So this bit here is the retinaculum of the ankle, and we've had a look at that before. There we go. And the blood supply passes underneath there. So if you try to, just pause that there. If you try to feel the pulse up here, you won't be able to because the artery is too deep and there's too many structures in front of it. You won't be able to feel through that retinaculum. But where the needle is now, I'm pointing there because my screen's there. So where that needle is now, just there, that's the dorsalis pedis just there. And on the dorsum of the foot, there isn't much tissue. So you can feel that artery quite easily. Okay, so it's around about the sort of talus area going into that first metatarsal. The best way to palpate it is if you use quite a broad palpation, okay? Because if you use a couple of fingers and you're just trying to find it like that, even if you're a couple of millimeters off, you'll miss it completely. Whereas if you put a flat hand on, you should be able to feel it somewhere underneath all of your fingers, okay? So that's a little tip for you. And we're going to have a look at that in a sec. So that so your anterior tibial artery off of the popliteal artery. I was going to say popliteus, off of the popliteal artery, and then immediately going through here into the front, all the way down the interosseous membrane, and then it pops out of the front and then turns into the dorsalis pedis, which comes down here and supplies the foot. There are some other blood vessels as well, but the main one we're interested in is that dorsalis pedis. So the next one then, this then goes down into the foot. Just going to move me out of the way. So we've kind of started where we finished the last video. So there's your tibialis anterior. So we should know these from the muscles. That one's your extensor hallucis, so extends your big toe, and then we've got your extensor digitorum just there. So we can see this is in between your tibia and fibula, and you can see the blood vessel just in there. Okay, so that's your anterior tibial artery. So we're going to follow that down now from there. So there it is there. And there it's popping out there. Okay, so, I mean, it does vary from person to person, but a good way to find it is if you get someone to extend their big toe and then you push against it, you should then be able to see their extensor hallucis tendon pop up. Okay, so it should be more prominent, and then usually the artery is just inside that. So that might be an easier way to find them. There are variations, of course. Everyone's slightly different. So you can see it a little bit easier here. So extensor hallucis is just there, anterior tibial, and then it comes all the way down here. Just move that out of the way. So we've got a little branch coming off, and then there's your dorsalis pedis just there. There it is, running it all the way down. And then it goes all the way down to your toes, so it's the artery that supplies your toes, and then dives through, just move me out of the way, to the plantar aspect of the foot. So this is where it dips down and then meets up with the blood supply underneath. Okay, so in between your first and second toe, it will just pop down and then meet up with the others underneath that. We'll have a look at that in a second. So that's the front, and then this one is the side. Just move me down there. So if you remember, the perineal muscles and the common perineal nerve is all on the outside of the leg. Okay, so it's on that fibular side. So is the perineal artery. So there's your popliteal. So that's behind the knee. So that one just there. That's your popliteus muscle just there. Fibula just there. So these are all the bits that we saw before. We're having a look at the back of the leg. And now we've got the posterior tibial artery, which is just here. Okay, so there was an anterior that popped through to the front, and then you got your posterior just there. And there's another little branch that comes off it. There we go. Just move me out of the way. And that one there, so see how it splits. So you have one going through to the front there. That will be your anterior tibial. Then it will come down a bit and then split again. And you've got posterior tibial and then perineal. Okay, so it splits again just there. So let's have a look at where this one goes. So there's your flexor hallucis, so your big toe flexor, the massive muscle that is. I don't think people realise. And then these, that's your perineal artery coming all the way down, so wrapping around that fibula, all the way down the back, and then it stops just behind the lateral malleolus. So it supplies all the outside, all that bit there, but then it stops here. It doesn't go into the foot. Okay, so anterior tibial goes through down onto the front of the foot. Posterior tibial will split and just come down the side and then stop here. Okay, and it will supply all of blood supply to all of the muscles in that lateral compartment. Okay, and that's your peroneal artery. Then we go posterior tibial. Now, this is where you can really get to see the popliteal artery, and it's a proper chunky one. So that one just there, there's your hamstring, and then your gastrocnemius muscles there and there. So you can see where the artery is really exposed in that area, and the popliteal nerve is next to it, and the popliteal vein. So all of them are in that knee crease, the back of the knee. And this is why you get advised when you're doing treatments, especially if you doing like deep tissue stuff, you've got to be really careful using your elbow behind the knee, because there's a neurovascular bundle around there, so nerves and blood supply. And yeah, if you push too hard, you can make someone's foot go numb. So you've got to be really careful. But you can palpate that artery. So if you bend the knee, there's nothing apart from skin over the top of that. So you should be able to feel that artery quite easily. Okay, and because it's quite chunky, it will give a good pulse as well. All right, let's just show you this one. So there's popliteal artery in between your gastrocnemius. I hope I hope you're not eating breakfast, Becky. Sorry. So there we go. That's a great shot there. Okay, so this is deep to the gastroc. So they've taken the gastroc muscles off, and then there's your popliteal artery just underneath. Popliteus muscle, and that bit there, that is the edge of your soleus. All right, so that muscle there is your soleus. So again, all the stuff we've seen before. So it dives below your soleus. There's your popliteus. Take off soleus, there we go, and this is what we've seen before. Okay, let me just hold that there. So popliteal artery, first branch coming off anterior tibial, then it goes down a little bit, and then it splits again, peroneal, which we've just seen, and then posterior tibial. So that one is coming down the back of the leg, deep to your soleus. So it's proper deep, okay, really, really deep in the back of the leg, and this is heading towards your medial malleolus this time. So anterior tibial, going through to the front, down a little bit, and then it splits into the peroneal, and then this one here is your posterior tibial. So it's running all the way down, and can you see the little branches off of there? Okay, so again, the supply for this is mainly the deep and superficial posterior compartments. So this is your tib post, flexor hallucis, flexor digitorum, plus your gastroc and soleus. So all of those muscles, the deep posterior, superficial posterior compartments, which we looked at a few weeks ago. So it supplies all of that. There's your transverse septum, which we looked at again when we looked at the connective tissue. So take that away, and then it runs all the way down. And then that there, just move me out of the way, that is your medial malleolus, just there. Okay, and then that bit of tissue there, this is what we saw on the connective tissue video, which are your tarsal tunnels. And there's the tunnels that the Tom, Dick, and a very naughty Harry go through. Okay, all through this area here, and there's the artery just there. So this area here, and especially just under here, where the retinacula is a little bit less thick, you can usually palpate that artery quite easily. Okay, so this is your posterior tibial artery. Just gonna play that. There we go. So there's your calcaneus, and then the posterior tib splits into two more arteries. So that one there, I'll just move me. So these arteries, exactly the same split as the nerve. So the posterior tibial nerve splits into the medial and lateral plantar nerves. The posterior tibial artery splits into the medial and lateral plantar arteries. So it's exactly the same, and they follow a very, very similar course. So if you see here where they split there, so you've got a medial one coming inside, so that one, and then a lateral one going to the outside, going to the little toe. So these supply the plantar surface of the foot, so the undersurface, that bit, all of that with blood. Similar again to the nerves, but obviously they supply the nerve supply. So those are those, and then there's a little branch that comes off that to feed the calcaneus as well. So the heel bone has got its own little blood supply, and then the last bit is this bit. So Tom, Dick, and a very naughty Harry, all in those tunnels there. So posterior tibial artery, and then it comes down. Just pause that. So we've got the medial artery to come in this way, and then the lateral artery going that way, and there's a little branch that comes off it as well that supplies the calcaneus. So there's your medial plantar, and it goes all the way down, supplies all of the muscles on the medial aspect of the foot, goes over some of the muscles that we've been looking at previously. Move me out of the way. So there you go, medial muscles and the hallux, so your big toe, and then there's your lateral plantar. Goes underneath your flexor digitorum brevis, the short flexor, and then a little branch there to the calcaneus, and then that supplies all of the muscles on the outside of the foot underneath. So all of these along here. There you go. There's the base of the fifth, so we were talking about that before, and that is where they join with the blood supply from the top. Okay, so that lateral plantar nerve will swing around and then meet up with the dorsalis pedis from the top, and then you've got a complete blood supply for the whole foot. Okay, so really, really good, useful design that, because if there's a problem with one blood supply, you can get it from somewhere else. Some bits will be supplied still, some bits will you'll struggle with. Oh, okay. Palpating a pulse has always made you squeamish. Yeah, some people don't like that. Yeah, it's it's a bit of a weird thing to think that you're feeling the beating of someone's heart through their blood vessels. Good. So that wraps up all of the foot. So we've had a look at everything. So we've had a look at all of the. Just pop that back on so people know which video we're watching. Yeah, so we've had a look at the bones, then the ligaments, then the muscles, all the connective tissue, all of the tunnels that things go through, all of the compartments that the leg is in, all of the nerves that supply the leg and the foot, and then all of the blood vessels. So you've got some good, well, hopefully some good revision videos to go from there. So if you're studying for a foot exam, then you can obviously watch those back again and again. There is a little PowerPoint that I just want to show you a sec. I think it's on this one. Yeah. I showed you this on the last session. I'm just going to flick through a few. Keep going. So we've done all of those. There is the last slide. I think I showed you it last week, and hopefully it will wrap everything up. Yeah, here we go. If I just put me there. Okay, so what I've tried to do is group everything into the movements, okay, which also kind of group into the compartments. So you've got superficial compartment, you've got your deep posterior compartment, so superficial posterior. This is your lateral compartment, so the blue, and then the anterior compartment is the red. So we've got tibial nerve, so anything with the ends in N is a nerve, and then it's supplied by then the different arteries that we've had a look at. So I've called the perineal artery on here the fibular artery. Okay, so apologies if it doesn't, if you're like, what the hell is that? So we got posterior fibular artery, which is another branch of that artery as well. So this will give you a good revision slide. Okay, so you can pause this and then you can then have a look at everything. So if you've got a person who's having a problem with plantar flexing, then you can see which nerve supply it is, which blood supply it is, depending on the symptoms that they're having, and which muscles bring about plantar flexion to try and narrow down what the problems are. Okay, so hopefully that gives you everything that you need. Yeah, if anybody's got any questions about the foot and ankle, then pop them in the group. I'm happy to answer the questions as we go through the week. Otherwise, we'll start next week with the knee, and we're going to have a look at the bony structures of the knee first of all. And yeah, have a great week. I'll see you next Monday. Cheers, guys.